Hello, this is Dr. Scott McLean. During this video, we'll be using the VERSAH Burs to do an internal sinus lift using a guided approach. So you'll see during this video, I'll be using a DTX fabricated guide from DTX Studio Clinic. And this is using an auto planned implant, so AI assisted and generated with the Sprint Ray printer. So you can see that when we make this, we can then do an auto plan, which will allow us to fabricate this guide. So we'll click the auto plan button, and once we have all the details in the computer, this allows us to plan the implant doing this with AI help. And this is really fantastic because so often it's difficult to use programs. This program is simple to use. So you can see as we do this that the computer knows where the teeth are, especially you can see the AI being generated, calculating virtual teeth, segmenting things, and getting things all ready for you to have a guided implant. So I'm going to use this to not only use it on the first drill, the 2mm drill, to go up underneath the sinus and not perforate the sinus, but I'm also going to use it to place the implant at the end of treatment. And I'll show you how to do this with this surgical approach. So when we have this, we can adjust this to make it sure it's exactly where we want it. And this is allowing me to get 4mm of soft tissue over top of the implant platform. We want to look at the residual bone height, which is about 6mm here, so it's 5.9. So RBH, or residual bone height, is important for you to understand. Our goal is to use mathematics and technology to plan this implant to get it in the exact position and to avoid perforating the sinus, of course. So you always want to stay less than 3mm past the sinus floor with the drilling protocol. The inventor, Dr. Sala, who's a lovely man and a fantastic and smart guy, when we can see what he's planned is he's going to go in counterclockwise, and we can use these tools to measure exactly where we are, so we can use mathematics to work out how deep the drill should be going. You can see the demonstration of the measurement from the gold ring, which is shown in gold here. And this allows me to measure exactly how far I am from the floor of the sinus, and then I can tell exactly where I am with the VERSAH Burs. And so when you're using the VERSAH Burs, I can measure how long the VERSAH Bur is and then reference this to that ring. And I actually still stay free-handed, but using the ring, and I'll show you what I mean. So we're going to make a guide, and the guide is going to be fabricated so that we're equidistant between the two other adjacent teeth. And this is going to allow us to be in a good angulation, depth, and position. And utilizing the 2mm drill, we'll stay 1mm short of the actual sinus itself. So we'll take this guide and it will allow us to get into the right position. Our patient has gone IPO and has been sedated with nitrous. You can see she's doing quite well. We're going to access with an H-flap, keeping it slightly lingual so that I can not have to deal with the lingual tissue too much, but also bring that tissue out to the facial and get that tissue in a more acceptable position so we can maximize the vertical soft tissue and get that 4mm we really need. So as we flap this back with a mulch, you can see we will elevate it and get it out of the position that's going to be in our way. So using the lingual flap approach, we're going to bring the whole tissue forward, and then it's not causing a problem. The other nice thing about this is that we end up having a very minimal flap, so the soft tissue is not elevated off the bone and the prosteum staying on the bone, and this provides good blood supply to that area, especially when this bone graft is healing. And so I think this is a real great idea, is to do a minimal flap. And if you're going to do a lateral sinus lift, you have to do a large flap usually. And we do those, and we have to do those when the bone is, less than 4 or 5mm. I would like 5 really. And then we go lateral approach. But here we can take the 2mm drill. We're going to stay 1mm short of the sinus. We just have to do mathematics and work it all out. So take the 2mm twist drill, which is a straight drill, and then stay intentionally short. I would suggest you look at the Densah Bur site, and so you can look at all the new VERSAH Burs and see what they've developed. It's just incredible. We're going to be starting our surgery out today with the 2.5mm VERSAH Bur in reverse, so in counterclockwise, with lots of copious water. So we want to have lots of water and make it stay cool. And we're going to try to have this, I'd like to stay around 800 RPM when I'm doing this. So we would start again with the 2.5, and then we would go to the 3.3, and then to the 4.0 on this in counterclockwise. Do not go in clockwise. We want to be counterclockwise on these three drills. And the drill is actually measured so you can test it. So you want to be 800 to 1500 and make sure you're in counterclockwise. So as we start the process, we can start doing osteodensification, which is taking the bone and widening it and actually making it a lot denser. I'm measuring my drill to make sure I know how deep that I'm going. And I can actually use the guide, or I cannot use the guide because the first drill has been already done on the 2mm, but we can use the guide to help keep us oriented and get this in the right position. And so we get depth, angulation, and position. So the guide will help us with this. We're not using the guide as a tight type of guide. We're using it as a guide that has some flexibility around the outside. So you can see I'm measuring the drill down to the different rings, and you can look at the kit itself and you'll know exactly where you need to be based on the ring height. And so I know that the ring is 9mm above where I want the platform of the implant. And so I'm not using the guide in a traditional way, but we're going to use it in counterclockwise. And you will feel some space around it, and the water can go up there very easily. And so it's by using a guided system that's loose. And so I'm just referencing the ring and not worried about where the teeth are, because I've already done that to the ring, and this allows me to get to the position that I want to go. Now, they do have new guided systems that I think are just phenomenal. I'm going to be trying those out next, and that's going to be my present to myself, is to get the new guided kit. But this is another way you can do it based on guided surgery, based on doing a ring that's pre-worked out in DTX Studio clinic. And so by doing this in Studio Clinic, you know exactly where your implant's going to end up, and I'll show you that in just one moment. You can see on this part I actually removed the guide because I'm using the VERSAH Bur to place the bone and to push the bone counterclockwise up into the base of the implant position. So this is going to do a dome the bone effect, and so you can see that when we do this, we're put some bone into the osteotomy and then put the drill in reverse and then push the bone up. And so we have to still be delicate and be gentle, but you can feel it, and you can actually feel how the body is taking the bone and accepting it. And you'll see the final x-ray, and it's really quite something how this technique works. So we'll be using Creos Allogain, which is allogenic bone, and this is what's recommended over a xenograft according to the manufacturer of the system. So Dr. Sal and the team said you should not use xenograft. It's better to use allograft here. So we're going to test the floor, and so I can feel the lift, and I can feel the base, and it's got a solid feeling actually on these cases when you do them. And then I'm going to take the bone, and we're going to use the bone to go into the osteotomy and have the guide out of the way. So we mix some saline in with it and just draw off any excess with a little bit of a cotton 2x2. And so you can see we're going to add the bone and some blood together. The goal is to make sure you don't go 3 millimeters past the floor of the sinus with your drill. It's fine to put bone in and push the bone up because the bone will be pushed out with a viscosity that is not too damaging, but you don't want to keep lifting the sinus floor past 3 millimeters. Otherwise, you could tear the Schneiderian membrane, and then that would be not a good thing to have bone all in the sinus. So the goal is that the bone can go up more than 3 millimeters, but you should not put your Versah Bur past the 3 millimeters according to the manufacturer. And you do have to, sometimes you have to turn the water off if you're putting this in, because you don't want it spraying all over the place. So once we get some bone into the channel, then we'll start to use the drill in counterclockwise. Don't forget that. Put it in counterclockwise so you're actually pushing the bone up into the area. And so you can push it up and then put some more in and then keep pushing it up. Just keeping an eye on how much you're putting in. Because I have 0.5 cc's here. And as you can see that this is going to be pushed with the Versah Bur in reverse. Make sure it's in reverse. So I'm measuring to make sure that I know that I want 6 millimeters of residual bone height to the sinus. So I know that I want to go 9 at the most, and then I don't want to keep pushing. So I can push bone up there, but I don't want to keep pushing with the drill and go past the 9. So as we do this, we're getting some bone pushed up, and you'll see at the end of the procedure the lovely dome that's over the end of the implant. And then this is a satisfactory way to have the implant engulfed in bone and to make it this easy for the patient. It's very simple for the patient, and when they get up from the gas, they can even drive themselves home and they don't have a lot of pain. It's a very simple procedure versus if I'm doing something where I'm doing a big sinus lift, lateral, then there is a lot of other things that the patient can be feeling during the procedure and after the procedure. During the procedure, a lot of banging and clanging. They can hear it up into their ear, into the eardrum. Here, there's nothing. It's just nothing that they feel. They feel very relaxed, and they don't feel like this is a big project by any means. So as we go in, we're letting the bone be pushed up with the Versah Bur. So we go through those 3 burrs, like we're going to be using the 4 here to do most of this. And so I'll take the bone and make sure that it's getting into the right position. And of course that we're going to be placing the implant and then having the sinus lift done in one day. So you're pretty much seeing the whole thing here based on what we're showing. So patient is not really feeling anything. They're not in la la land, but they're feeling comfortable and they can communicate with us. Blood pressure is good. If you have sleep apnea, you've got 100% oxygen being pushed up into the nose. So it's not like if you're sometimes sedated and you start to drop off. So you've got actually oxygen going in there, which is great. So the patient's almost done here, and then we'll put the implant in, take some x-rays, make sure everything is good, and then we can have a look at the x-ray itself and see what you think. We're now going to start to place the implant once we have the bone positioned. We're going to be using a Nobel parallel implant, and I like to use this implant because it does have more of a flat end, and I don't want to have something that has a sharp end like the Nobel Active. My preference is to use this because it's going to help to push up the bone and the Schneiderian membrane and not tear it. And so I do like this implant. I think it's a phenomenal implant. It's got a uniform thread, so as it goes in, it's going to be in an osteodensified bone, which is going to be key for this to have success, because the bone is a bit denser now since it's been packed in there in reverse, and then as you see, we put the implant in and it's grabbing quite nicely, and this is in the posterior maxilla, and we have a 0.3 reduction. Now what I do like is the fact that we're going to use a bone mill because we are subcrestal by a little bit to make sure we have our vertical soft tissue. The vertical soft tissue has to be, in my mind, 4 millimeters. So when we do this, then we're able to get some bone mill, and then we're able to have the healing abutment go on, and it actually prevents the implant from being pushed into the sinus, because who likes that? If you have someone bite on it and then it slides into the sinus and you have to get that out. So we use the bone mill, and I am happy to say that I'm the one who designed this particular kit. Bone mills were made before this, but I was the one who designed the CC bone mill. And so now that it's not going to be used as much on the new vertical soft tissue, but here it's perfect for doing this because we are subcrestal, and I want to have it so that it makes a bevel that makes it so that the implant can't be pushed. And so it's just another safety marker for doing this procedure. So we put on the healing abutment, and we're going to take an x-ray in just a few minutes, have a look at the dome that we've created with the bone, and so you can see here that we're going to get this job done. So it's phenomenal, just phenomenal. So we are going to use the CC bone mill here. You can see just tapering off the bone over top of the platform. It protects your platform. Now, don't get confused. The Noble Active is an awesome implant, and I use that for my immediate placement because it's going to actually pull some of the bone back out of the osteotomy. Where here we don't want to do that. We want to push the bone up. So we're using a different implant system to do that. So you need to know what your implant's going to do when bone graft is ahead of it. So, I love the Noble Active, and I love the Parallel. And so they are working in tandem for me when I'm doing different types of jobs. So if we put on the healing abutment, and then we'll put a few sutures in, and then we are ready to go. And so this is the key to a successful Versah Bur sinus lift. And so counterclockwise, we want to make sure that we're staying less than 3 millimeters. Those are the big tips. And use lots of water because we want to keep it cool. We don't want to make a problem for you and your patient down the road by having it heat up too much and you lose your implant. So this is Dr. Scott McLean as we finish up we're putting in some gut here. Normally I'd put in actually a vicryl suture, but the patient's coming about 4.5 hours, so we're just going to try to do it this way. It's a very minimal flap. I don't think we'll have a problem. So as I said, this is Dr. Scott McLean, and we'll show you this as we finish up. And but thanks for stopping by.
Good job.
And to check out the video. I think you should explore. Go to densah.com and explore some of the new products that are coming out with this system. I know that Noble Biocare has purchased a system, which I'm proud of, and I think it's an amazing thing for our team, and you can see we're quite excited. So here's some of the products that we used, and we're able to get the job done and have the patient do it with just Nitrous. And Nitrous is a wonderful thing. If you haven't used that, learn how to use it and start to make your life a little bit easier. See right here, this is where the bone graft is sitting up here, and this is where the sinus was starting. So before we used to have to make a little circle in here and go in sideways, but we did everything from this way. And we have enough tissue from the top of the implant to here. That's 4 millimeters right there. So that's about the perfect way. So when you go to see Dr. Dan back to have this done, he's going to take this piece off. And so this piece also, the fact that we have a little bevel here, this can't go inside. It just won't go. So we have this part to hold that back. So when he takes this off after this heals, we'll give that 4 months to heal. And then you take this off and he puts it in 2 months. And we have to have a perfect tooth again. Okay? So here's the final product. You can see the bone dome, and love it. It's just amazing. We've got a really nice doming effect, and you can see that the bone is around that implant. So check out the VERSAH Burs from Densah. I think you'll really enjoy it.